Welcome to your presentation for the QUALIFI Level 5 Certificate in Aesthetic Practice for completing the SAQ paper for AP501. Through this presentation, I'm going to go through the marking criteria and how you can make sure that you include all the indicative content needed to be able to successfully pass this work. So the SAQ marking criteria does differ to that for the assignments, but there is still some set criteria that needs to be met. So I want to make sure that you're understanding how you will successfully pass this paper. So you must gain a minimum pass. And to gain a minimum pass for each question, your marker will mark each question individually, but they will accumulate to an overall pass. So you may do really well in one question, not so well in another, but overall it will still be a pass. Your marker will take into consideration the level of content that you've put in, how you've applied your theory, so thinking about how you've wrote academically and not in a lower format with lots of bullet points and simplified sentences. They're going to look at the way you've researched your assignment content and then applied your own knowledge and understanding and opinions to that. They will also be looking at your presentation, so your formatting. So still go with that 1.5 centimeters or 1.25 centimeter spacing between, the same as your assignment criteria. And also start to think about using the right font, Calibri in 11 or 12 size, as well as sentence structure and referencing. Now, referencing is not compulsory for this SAQ paper, but it is something that your marker will take into consideration when giving you a pass mark. So you may want to start to look at including some references, but maybe not as exactly as many as, say, your assignments. And also you won't get marked down if they are not Harvard referencing. So if there is some complications with the referencing, it's not as essential, but it is something that your marker will take into consideration at how well you've done this. So please be aware of that, or understand that you won't get the higher marks for a question answer if you haven't applied that knowledge and understanding and shown your research methods with referencing. Now, to pass the paper, you must get a minimum of 4 marks in a question, but you cannot just get the minimum of 4 marks for each question, because that won't overall give you the highest percentage that you need to pass. Now, the highest percentage you need to pass is 65%, and that is worked out over the amount of points you earn. And there's a maximum of 80 points in this, and the minimum you must get is 52. So if you score 4 in one question, that's still a pass. If you got 4 in every question, the whole paper would be a fail. But you could get a 4 in one question and a 9 in another, and that would obviously balance out your overall grade. So please be aware, when you get your papers back, have a look at your feedback you get from your tutors. If they scored you a 4, but your paper was overall a pass mark, still look at that feedback and make sure that you can improve on your next SAQ paper. So make sure that you are aware of the points awarded and the minimum, and for this paper it's 52 out of 80 points, which will work out at 65%. Everything is a pass, so whether you get 99% or you get 65%, it is still the same grade. There's no pass merit distinction graded scales within the SAQs. They are just pass and fail. Word counts are given. They're usually anywhere between 300 and 500 words per question, but they are a guide. So if you do go slightly over, then it's not something that you will be marked down for. It's just bearing that in mind when you're thinking, how much detail do I have to put in? That's something to consider, not going too over as well and using more words than you needed to answer a question. The same with if you are under the word count, it's not technically a fail, but if you look back at the marking criteria, you may not have obviously applied your knowledge and understanding to the content, so therefore it will be marked down. I hope that all makes sense. So let's look at question 1. So the important part is to look at the verb that the QUALIFI have stated, because this will determine how you have to write and what you have to sort of include within your answer. So question 1 is to analyse an employer's, so not an employee, but an employer's legal responsibilities for health and safety in aesthetic practice. And you must also include infection control. So if we look at the verb, it's asking to analyse. So that basically means to examine carefully, sort of in detail, lots of things to do with the legal responsibilities. So put it under discussion. So what the qualifier would expect to see in your answer is that you've researched, and obviously a way to prove that research is obviously through referencing and mentioning who you've done and who you've sort of looked at. It's also going to ask you to look at it in detail and break it down into the essential key parts that link to aesthetic practice. Make sure you are always linking it back to the aesthetic practice, and you can also put examples in your own practice as well. So where you are currently working, what are you applying with regards to sort of your responsibilities if you're an employer with health and safety, or what you would expect maybe your employers to include. You need to make sure you're looking at the positives and negatives. So if something wasn't followed, what could happen? And if something was followed, what are the positive outcomes? So look at both sides of the argument and make sure you mention positives and negatives. So indicative content, which is available on the Qualify website when you look up the qualification, is what things are they expecting you to possibly mention in your assignment. So they are going to ask to look at things like the management of health and safety of work regulations, things like first aiders with regards to equipment, first aid, when's their certificate completed, when does it need to be renewed, manual handling, lifting, and obviously bending over and working with your clients, fire safety, and what are your responsibilities as an employer to making sure with testing alarms, evacuation policies, and firefighting equipment. Also, the employer's responsibilities under COSH and RIDDOR, the main Health and Safety at Work Act, which is obviously the umbrella act that most of these come off of. What are your employer's responsibilities with regards to risk assessments? And also your infection prevention control measures. Now, I know in level 5 we're not using prescription medicine, but remember we're starting to look at aesthetics as a whole. So it is expected that you would be talking about POMs and prescribing and storage of these POMs. Also insurance, so employers' liability insurance and the public liability insurance will be something that you should be mentioning. And also Electricity at Work Act. So things like testing equipment, PAT testing, what does an employer have to do regarding the law to this? And again, I cannot stress this enough. If you are looking for those higher points, you must be giving examples of how these could be implemented within your own actual practice, or something that you already know is implemented, or something you would even implement as an employer. You need to use reliable sources when you are researching for any assignment. Taking the top thing that comes up on Google is not always going to be the best. So you need to make sure if you're talking health and safety, you're talking POMs, you're talking infection prevention, these are reliable resources. You obviously can find other reliable ones, but let's face it, health and safety executive is going to be the overall main body you're going to look at for health and safety. Things like infection prevention measures through the NHS, the MHRA, or JCCP are also going to be reliable resources that you can reference within your work. And I will say I use these a lot throughout the whole of my assignments, so they are something that are a sort of a standard to most of these assignments. Then if we look at the marking scheme that your marker will use to mark your work. Now, as we said, the minimum pass mark is a 4, but if you got 4 on 8 questions, then you would not pass. So they are going to award you marks out of 10. So 4 to 5, think of this as a minimum sort of pass that you've basically outlined. You've put very simple bullet points and just sort of said these are the employer's responsibilities under the subheadings for health and safety and infection prevention control. If something you're planning on moving on to in level 4 and level 7, you want to be aiming for at least the next category on, the 6 to 7 mark. So the 6 to 7, you have outlined, but you've done more than outlined. You have described the reasons for giving specific examples of how the employer's responsibilities to health and safety are implemented. How are they actioned? It could be meetings that you have with health and safety, induction policies, regular updating, things like that. So don't just outline them, describe them. And then if you want those higher marks, you have to analyze them and talk about the positives, negatives, infection control measures, go into detail, identify the possible results if you do not follow these practices. That will give you possibility of getting the 8 to 10 marks, but remember your marker will also take into consideration referencing, formatting, and the wording you use, sentence structure, all of that will also be taken into account. But this is the marking criteria for question 1. So if you move on to question 2, so now we've got to evaluate the types of health and safety systems that should be in place for aesthetic practice. So what I would make sure you do when you go to sit and do these assignments or questions, make sure you look at what each one is going to be asking you, so you don't cross over with them, because you might talk about more of the types of health and safety systems in the first question that you should really be saving for this question. So what you want to make sure you're doing is putting maybe like brief summary, piece of paper, make sure you talk about this, this, and this for each question, so you don't have these crossovers and end up repeating yourself a lot. So now we're going to evaluate. So think of an evaluation as more like a reasonable argument. So it's more like you're going to give both points of view, strengths, weaknesses, positives, negatives, whatever way you want to look at it. But you're going to evaluate both sides, and then you're going to come to your own conclusion. Now, your conclusion can be throughout, or it can obviously be at the very end. So you're going to evaluate and judge the significance of the importance of these health and safety systems, and do you think they work or they don't work? How do you think they could be improved? Work out what's the value of your answer. Have you raised necessary points? How do you feel about what you found and evaluated? So you do have to put your own spin on this and start to apply your knowledge and think about, is it good or bad? You can talk about good and bad examples that you may have experienced, or things that you have implemented as good practice within your practice itself. So make sure that you look and research, and do you agree with researchers? So remember, this is like an argument. So points to consider mentioning, your indicative sort of kind of content for question 2. Start to think about written health and safety policies. Do they have things like the temperature, lighting and welfare facilities as well? Risk assessments, and this could be down to risk assessments for a premises, it can be for a treatment, it can be for the storage. Think about all the rules that come off. It could also be thinking about things like pre-screening your client's medical history. That is in effect a risk assessment also. So how regularly are policies checked and updated? Think about, is that a year too long? Should they be updated more frequently? When should they be updated? Definitely, if there has been an event, that is something that you would need to look back on and think, was the policy correct in place? And if not, redo it. And again, stressing again, give examples of how these could be implemented within your own practice. And again, like I said previously, the Health and Safety Executive is going to be your main reliable resource. And I'd also link it to sort of UK government legislation. These are going to be your most reliable sources of information to help answer this question. And again, if we look at the marking criteria for this as well, again, we've got that 4 to 5 is like your bare pass, and then we're building on that to get the higher points. So in question sort of 2, The minimum pass mark you've outlined, so simple sentences, bullet pointing. You're not actually adding much detail at all. It's something that's barely level 4 criteria, let alone level 5. You've outlined the main types of health and safety systems that should be in place for aesthetic practice. Make sure again it's got that aesthetic practice. 6 to 7 is kind of your middle of the road, and that's really where people should be as a minimum aiming for. The learner, you have actually interpreted the policies and laws and procedures that should be in place, and you've given examples of these that could be put in place for aesthetic practice. So it's that examining, evaluating, and deciding what is best. And then the learner, to get 8 to 10 marks, you've obviously evaluated with detail the types of health and safety systems, and also the value of them and what could go wrong if they weren't in place. So remember, look at both sides of the coin. Personally, I found this one very simple and easy to do because it should be something that you are doing every day and should be a second nature. So again, we're evaluating for question 3. So we are doing obviously a reasoned argument. We're looking at the positives and negatives. We're making sure that we're discussing and looking at the value of each point, positive and negative, how you feel about that answer, what are your personal opinions, and do you agree with researchers? So remember, argument. Look at that command verb, because if you're not following, if you're not evaluating, then it will be sent back because you have not answered the question. So make sure you're always evaluating. So question 3, it actually does state you have to make sure you cover 10 infection prevention protocols. So these could be coming under wearing gloves. It could be sickness, whether it be yours, whether it be the client's, waste disposal, cleaning procedures, hand washing. There are way more than 10, and it's just asking you to narrow down 10. Try not to have them crossing over too much as well, because your marker may say that, points 1 and 2 are the same. So make sure that there is a slight difference. You need to also as well give examples of how to implement these measures and include them within your actual practice yourself. I mean, simple things like wearing gloves, having them available in the room, washing hands, having a sink and hand washing station, making sure that you've got correct waste disposal. These are all easy things, and this question is quite a nice, simple one to answer. The mistakes that people have made over my time of marking these is that people don't do 10. They lose track. So make sure you can either put a number by them just so that you know that you've done 10, or sort of tick them off a list or count them up at the end. It doesn't matter. But if you've done 9, not 10, it will be a fail for that question. When you do your research for this, if you do a Google search, Royal College of Nursing, or look under preventing and controlling infections, you will find a massive list of way more than 10. And that is, again, a very reliable resource because it has come from sort of NHS and sort of the government as well. So this is a super easy one to research for. So sometimes this question is great. If you're looking and think, all right, I don't have that long to answer questions, I've just got to get in and get one done. You don't have to do the questions in order. You could start with this one and think, well, that's an easy one to start with just to get my brain in the right gear. And your marking criteria for this is, again, as it says, at least 10 infection controls. You can always do a bonus one if you want, just in case. But you have basically, for a minimum pass mark, you have outlined the essential aspects of 10 infection control protocols. So again, this should be something that you shouldn't be aiming for just getting through it. You should be aiming to look at thinking how you can describe them and give examples within your own practice. And if you're going for the higher marks, determine the significance of them. What could go wrong if they weren't in there? Do you agree with them? Remember, it's an argument. Question 4. So now we're still doing the evaluation. So you can see that the command verb for the assignments are very similar. You've got to evaluate the several types of health and safety records that must be managed and maintained within aesthetic practice. And not just that, What's their effectiveness? How effective are they? Are they good or bad? So again, this can be like health and safety records, could be anything from client consultations through to risk assessments, through to accident forms. So it's looking at the records that are kept and how effective they are, but make sure it's linked back to aesthetic practice. So it actually does state that you've got to make sure that you have covered at least 5 different types of health and safety records. So evaluate the effectiveness and make sure there is at least 5. You could break the records down, so it could be health and safety records for the building and the contents, and then, as I said, storage of client information, record cards, what training is given, the products being used. You can look at obviously your fire safety, making sure you've got the correct protocols in place for an evacuation. Safety data sheets for your products, making sure that they are available, especially things like tattoo inks and chemical peels, must have your safety data sheets. Making sure, as I said, your data protection, that comes under health and safety as well. And then your accident reporting and first aid. So you can see there's way more than 5 even on that list there. So make sure you try and give examples of these within your own practice also. And like I said at the very start of this, your referencing should become very easy because you're going to be using a lot of the same ones throughout your piece of work. So your reference list will be just reused a lot. And like I've done on previous presentations, if you use the computer, if you use Word to do it, it's there, it's stored. You can just import it in from any previous work as well. So it makes your life a lot easier with referencing. Very simple, very effective, and it takes the stress out of referencing. But reliable resources are going to be the same as what we've used previous questions. So your marking criteria for this, again, you'll start to see they are very similar regardless of the questions. So as it said, it's need to do at least 5 different records to consider. If you just outline the basics of them, you're going to not get the higher marks. So outline 5 different health and safety records, them how they're managed, maintained within health aesthetic practice, and state their effectiveness, so how good they are. That's it. You've just stated facts. There's no sort of evaluation really completed. If you have obviously explained 5 different health and safety records, so a little bit more than just a basic outline, you've just done some explanation, how they're managed within aesthetic practice, and then you've done a summary of each one and how effective they actually are and what they're doing. And then 8 to 10 questions is going to be is going to be more like looking at how they're managed, and you've judged how effective they are. So you've actually not just summarized their effectiveness, but in your opinion, how good they are and why they are so good. That's sort of where you'll look at getting the higher marks, because you're starting to impart your own wisdom from the research, and that is a key thing with working higher levels of qualifications. You have to start putting your higher order thinking skills onto the paper. If you are keeping it very basic and very simplified, you are not showing your knowledge. So we're halfway through, so we've done questions 1 to 4, now we're on question 5. So we're still sticking with that evaluating, so we are still doing that argument, and we're now going to be looking at sort of hazards, clinical hazards associated with aesthetic practice and the controls to be implemented. So you can see how I said earlier that you've got to make sure that when you're answering each question, you're not doing crossovers and you're trying to keep different questions or different answers for different questions, so you're not repeating yourself. So we're still doing the positives, negatives. Do you agree with researchers? The last few questions have all been evaluations, so you should be understanding now the command verb of evaluating and what it's asking for you. So again, the question does stipulate 10 types of clinical hazards and the control methods. So again, you've got some generalized ones that could be for any workplace, things like slips and trips and fire exits not being blocked and staying clear. That should be standard throughout the whole of any workplace. but start to find some specific ones that are more clinical and aesthetic in base. So we've got allergies, you've got anaphylaxis. What is the control methods that are put in place? Find more examples that will be associated with that aesthetic practice. So you can do some generalized ones, like I said, the slips, trips, fire exits, things like that, but try and also link them to the clinical hazards and control of preventing these accidents. And you can also, again, give examples of how these could be implemented within your own practice. And again, you're probably noticing the theme, like I said previously, the same resources are going to be used for this whole assignment. So the infection prevention control methods from the NHS is pretty much the little Bible for this. Your health and safety executive, which the NHS would have used for writing these down. Obviously, with regards to POMS, you can use the MHRA, and then you've got the JCCP, which has got a very sort of concise document out there of what they think should be implemented as good practice. And again, probably it's becoming repetitive, but you got to see that it's, keeps it standardized. Your marking criteria, the 4 to 5 marks, is that you've outlined 10 clinical hazards associated with aesthetic practice and the controls that are implemented to prevent accidents. If you've gone into a little bit more detail and you've given some explanations and you've put a summarized sort of method of control from research, then you will get the higher marks between 6 and 7. And get the maximum marks, you've done sort of 10 associated hazards. You've judged the value of the methods that are being used to implement them, and you've judged them to be correct, or you think that they could be better, or what is your personal opinion on these. Remember, make sure your opinion is backed by fact, and make sure you don't waffle on about things that are irrelevant, because then that will drop your mark down. So with the marking criteria, you can see some questions you might feel really strong on and not so strong on others. So try and, the questions that you think, yeah, I feel like I could get this, aim high for those. So it means that you can get a little bit less on some of the others and still have an overall pass. So question 6, we're still evaluating, we're still going with that argument. So we're now evaluating the how good, how effective risk management and risk control systems are. So it's about looking how good are those systems in place at preventing the occurrence of accidents and events. So remember, look at your positives and negatives, how you feel about that. Do you think they work? Could they be better? How could they be implemented better? So your indicative content for question 6, you could consider mentioning and doing research on risk assessments and risk controls, which you've probably already done from the previous questions. So it's just building on some previous knowledge. Looking at your fire safety, your electrical equipment, where you buy it from, how often is it checked? First aid training, how often should it be? Where should you get your first aid training from? Record keeping, making sure it's stored correctly, consultations, making sure that you've got high standards within your clinic on your prevention of accidents, your infection control measures, and determine the significance of their use. Why should there be systems? Why are they beneficial? A lot of the time it's because it's evidenced, so that if there is an occurrence of any claims or any instances, if you can back up that you have been following systems effectively and you have provided staff with training, if that staff member chose not to do or keep up their training, as long as you have tried, then it means that sort of if it goes through legal battles, you've got the evidence to back that up. If you haven't, then you're going to be at fault. So make sure you think about these things, the positives and negatives. And again, you can look at adding in your own sort of actual practice. And again, you're just going to be using the same resources that you've already been using. There's no point in finding something new if everything's in something that's reliable already. And with the marking criteria for number 6, as I've already stated, if you go just for the minimum pass on each question, you will not pass overall. So, just doing a basic outline and how effective a risk assessment is or risk control methods are in a very basic outlined way, you're not going to get the higher marks and you will not pass. If you've tried to describe them and how effective they are, and you've given very specific examples, then you will sort of be in the possible criteria of getting the higher marks. And then to get the maximum marks, you're going to have done an evaluation. You've really looked deep into some of these, and then you've paraphrased, you've put how effective these risk management and control measures are, and the significance of why they're there in the first place. That's going to show higher order thinking skills and go for the higher marks. So question 7, we've moved on from evaluation, we're going back to our analysing. So we are now doing an analysis, and so carefully examining sort of factors and different things for discussion. And this one you might find quite interesting, especially if you are a lone worker. So you've got to analyse the legal duties required of a lone worker for risk assessments, handling and storing of medicines and waste carrier licences. So some of you may be a lone worker. You might not be working within a team. You are your team. So you've got to look at your legal requirements as well under health and safety to make sure that you are working responsibly. And also, so this might be a great way to obviously start to give examples of your own practice, or it might highlight to you some of the things that you maybe should be doing better. So you've got to start looking in close detail and breaking into essential parts the legal requirements of someone who is a lone worker. So for this question, you might want to start with stating what is classified as a lone worker. Also because it's asking you more about the POMs and medicines, so the storage of these. Talk about the yellow card system. What is it and why is it there, and why should you be aware of it? And if you're not aware of it already and you're doing aesthetics, then something you really need to be aware of straight away now. Making sure that your waste disposal are your responsibilities under your clinical waste, your sharps waste, even your general waste will come under health and safety. So what are the benefits of your answer, and what could happen if you are not following the legal duties of lone worker? Remember, we've got to look at the positives and the negatives when we're doing this, and then summarize your arguments at the end or throughout, depending on what makes more sense when you're writing it. Try and make sure you're starting to implement and mentioning your own actual practice as well. When I did my own assignment, this is something that I forgot to do a lot of time, and I missed out on very essential marks because of it. And again, like I've been saying, you're going to use the same reliable resources throughout the whole of this. Anything health and safety, you're always going to go to the health and safety executive. Then your marking criteria for question 7, again, minimum marks is going to be a very simplified, summarised legal duties of what a lone worker has to follow. If you start to give a little bit more detail, you've just done some explaining and you've talked about some specific examples, then you're going to be looking at the higher marks. If you want to really push yourself, you've done some more detailed analysis, you've started to look at the value of following these rules and why you should follow them. And then the last question, question 8, we're still with our analysis now. So we're going to analyse the potential risks of lone working as an aesthetic practitioner. So make sure that when you are researching this, you are linking it back to the aesthetic practice. So again, we're looking in some detail, we're breaking down essential parts, looking into a little bit more depth. And again, if you are a lone worker, it might be something that you can use plenty of examples in your own practice. Now, it does state to make sure you have covered at least 5 types of potential risk. So they could come under, think about the security of yourself and even your client's possessions, but more so your own possessions. If you've got a room somewhere and you've got your fridge, you've got your hydraulic bed, you've got all your POMs stored in there, that's quite expensive, and obviously an issue of making sure that your stuff is secure. First aid, you are responsible for your client's first aid from the minute they walk onto your premises. So do you hold a first aid certificate? Is it enough? Is it still legally in date? Also, something to think about, abusive clients. If it's you in a room with a client, you can be open to potential risks. So what are your protocols that you could put in place for dealing with abusive clients? And then that can lead on to as well, if you're a lone worker, can be very stressful, especially when you're trying to do your social media, you're trying to sort of balance a work-life sort of balance. You're trying to make sure that you're still making ends meet. You've got to do all your ordering and fit it in around your clients. A lot of people like to think about being their own boss, but sometimes it's those things that they don't realize that they don't have anyone else that can help them. So how could you manage that risk and deal with that potential risk so it doesn't happen? And again, if you are a lone worker, you can start to actually sort of think about your own practice. On the Health and Safety Executive website, there is stuff on lone working. There is quite a lot of legislation and reliable resources around lone working as well. And like the question says, you've got to do at least 5 types of potential risks. So make sure that you have covered 5 when you're reading it and sort of proofreading your own work. Make sure if you just outlined the risk of working as a lone aesthetic practitioner, you're not going to get the higher marks. You'll get between 4 and 5. If you push yourself and do a little bit more description and give some specific examples, then you will obviously be in the criteria of 6 and 7 marks. And then thinking about how well you apply that knowledge and examine the potential results of implementing certain strategies will be potential of getting the higher marks. So when submitting your work, you need to make sure you submit your work on the actual SAQ paper that is the QUALIFI standard one. You need to make sure you've researched your methods reliably, and even though it's not a requirement to reference, make sure that you are showing your marker that you are using higher order thinking skills and researching, and the only way you're going to do that is through referencing. Try to stay within your word count, but don't panic if you go slightly over or under. If you go over, you might be in danger of being waffling too much or not put the right information in for that question. Or if you go under, you may find that you could have expanded a little bit more on your knowledge and you could have got some more points. Try not to do them all in one day. It would be impossible to try and do 4,000 words with research all in one day. Try and pick one question at a time. I used to do mine on a draft, so I used to do them on a separate Word document and then copy and paste them over to my actual document at the end. So that way I could do a draft copy and I could delete things if needed. Also, get someone else to read your work. It's best actually to get someone to read your work who doesn't know the question answers. So that way then you can find out from them if they've know more from reading your answer. So that's how you can complete your AP501 SAQ question paper. Then make sure you submit it to your marker who will mark it, and if you have got under the pass criteria, it will be sent back to you with some feedback so that you can amend and then resubmit. Good luck.